So hello, everybody. Hello, IAGC conference participants. I'm Robert Dilts.
I'm Emanuela Mazza.
And we're the co-creators, the co-founders of the SFM, Success Factor Modeling for Healthcare project. And we want to go over the current state of this project and our plans for the future.
Yes, I'm from Italy. And I'm a coach and an NLP trainer certified by Robert. We started this study last year in Italy for the first time in the world by applying the methodology of success factor modeling. And we had the first results that we presented in Rome last January.
So we want to kind of go over with you what this, what we discovered. And so here's our first slide, which kind of shows the idea that our goal was to really look at the whole healthcare ecosystem. So not just model, one doctor or one hospital or one team, but really look at the whole ecosystem. And
the first idea was based on the success factor modeling methodology, and through the 3 steps that Robert explored about entrepreneurs and generative collaboration and conscious leadership and resilience.
So we really, the whole notion of success factor modeling is, asking that question, what's the difference that makes the difference? And kind of then looking at these 3 different areas of, mindset, which produces actions, which produces outcomes. So we really wanted to look at what kind of characteristics of mindset are most likely to create effective healthcare results.
About the study, we started in June of 2019, and now we are going to start the 2nd year. And we received 137 answers from people for the 1st and 2nd part of the research.
And so, what were we wanting to do? We wanted to identify the key factors of successful performance in different areas of the healthcare system, put those into a model. And part of what we're doing now as part of this project is coming up with specific tools and skills which help to transfer those so we can bring them into different areas of the ecosystem. And then, of course, support it with kind of other types of things like coaching, masterminds, and webinars like we're doing now.
Yeah. And the study is built in 3 steps. The first one is an online survey, and the outcome is to understand the different criteria for success from different perspectives of key areas and from different players within the health ecosystem.
And then there's another online surveys explore these different levels of success factors and, for specific case examples, and then doing in-depth qualitative interviews.
And yes, and the 3rd step is about qualitative interview, and we are already doing some interviews, and we are gathering very interesting case histories of success.
So again, we sent out our survey to doctors, nurses, and other healthcare professionals, patients, family members, caregivers, both public and private healthcare providers, universities, research institutes, but also, scientific associations, insurance companies.
Yeah. Yeah, the whole ecosystem, or where we can reach people in the health ecosystem with an outcome to understand how different people in different areas could think about success and what are their success factors.
So of the 137 responses that we'll just quickly go through, we were keeping track of the age group, the gender, which region, this is in particular with respect to Italy, level of education, and which kind of organization. So you see we got a lot from the public healthcare providers and then private healthcare providers. So this was kind of our snapshot of what kind of answers we got. We are also looking at different levels of success factors. I think many of you might be familiar with this pyramid model of the different dimensions of possible success factors.
And yes, and the new thing is that in the healthcare field, also in Italy, is a very new tool, is a very new approach. So this is the reason why we are doing this, in order to provide some new tools, some different approach to achieve different results.
Yeah. So what did we find? So here is our first results from that first group of people. And we started with, well, what were some of the outcomes? So one of the questions in our survey was, how do you define success in the healthcare field? We had people think about one or several cases that they considered to be really good examples of success in healthcare, given their perspective and from where they were in that ecosystem. And then we had them select a number of statements that were put together from different organizations.
Yeah, we took them from World Health Organization, the Centers for Medicare and Medicaid Services, and from the Institute for Healthcare Improvement, AAA, and also from success factors that we use in success factor modeling or in the business coaching and something like this.
And so these were our top results of what people said were the most important outcomes to create a successful, healthcare result.
Yeah, the first one is all the actors are involved. The 58% answer choose these statements. And the second one is very good team relationship and interaction.
The third one was very clear and effective communication, in particular between doctors and patients, but I think communication overall was still considered important. And then the final two, which were roughly equal, is each team member knows their roles and tasks. And
yes, and sorry. And an interesting thing is that the most important results are about involvement and communication, interaction. And if we think at the period that we are living now, how much important are these factors, these outcomes in this emergency situation?
Yes, absolutely. I think this is one of the things where I think is particularly important, that as you'll see, some of the results of this study, I think, are so meaningful for what's happening in the world right now. Our final one about very efficient and effective healthcare provider organizations. So there's organization, communication, team interaction, and that all the actors are involved. So we then, to model that, to create our model, these were the words that we felt characterized these qualities of outcomes. So engagement, people are involved. Empowerment, where you have good team relationship and interaction.
Effectiveness, about very clear communication, and efficiency and expertise for very efficient and effective health provider organization, and about each team member's knows, roles, and tasks.
Yeah. And so we put this into what we called our outcomes wheel, and you'll see how these all fit together. So these were basically the 5 things that seem to be the important outcomes to achieve effective healthcare, no matter where you are in the ecosystem.
And about actions, the question was identify the most important actions that contributed to creating the successful cases you have chosen, just to identify the key actions.
Here we have a very strong one. 71% said protocols for communication for addressing key issues. So again, communicating being very high.
Yeah, if we think about communication in these last 2 months in medical environment and also institutional environment, how communication protocols could be useful.
We know that, I mean, it's been seen, they were saying that actually the one of the biggest viruses, you know, thought viruses, is miscommunication, and that miscommunication can create either overreaction such as panic or underreaction. I mean, it can be deadly. A second one there was work routines and procedures, and then prescriptions for responding to particular situations.
Yeah, that could be very essential in this period.
Yes.
And other 2 answers from other responses from people that answered to the survey are strong interrelation between professionals and involvement and collaboration.
So we similarly then, as we organized these, and these are examples of the kinds of things that people answered, but we said, so obviously one key factor then is to communicate. So having those protocols for communication.
And the other one is care about this kind of strong interrelation between professionals. So care is a bigger word that could contain many things like empathy, like many other characteristics. Yeah. And the other one is co-create about prescriptions for responding to particular situation. And we are living and we lived and we are living and sure we are going to live a particular situations, many particular situations.
This is where the generativity comes in. And by care here, we also mean care not just as a feeling. We mean care as an action, that people show care, they take care. You know, so it's caring behavior between people and patients. And then of course, collaborating. You can see so much how this current situation, these are so relevant, that to communicate, to care, to co-create, to collaborate.
And the last one is the clarify, to clarify work routine or procedures. And we know how much is important to know what to do and how to do in specific situation.
So this was our actions wheel, our second wheel. So we had our outcomes and now our actions. And then of course, our final part was around the area of mindset, which has, and there's different, here there were different levels of mindset: capabilities, beliefs, identity, and vision. And we'll start with capabilities.
We started with capabilities, asking what are the most important skills and capabilities that you think facilitated the successful performance you have identified, just to understand the most important skills.
So not surprisingly, because you see the pattern emerging here, that the most important skill was identified as communication skills, 66%.
And the other one, emotional intelligence, 54%.
Problem solving was 58%.
Yeah, and self-awareness, 44, no, interpersonal skills, 49%, and self-awareness, 44%.
Which is very interesting, as we see, because we know obviously problem solving skills would be important, but the interpersonal and the emotional intelligence and the self-awareness, I think were all really, really interesting, that these were what people said characterized these successful examples.
Oh yeah, and there is, for example, in Italy, a survey, an online survey that a research group made last March during the emergency that we are living, and one about the needs of doctors in that period. And one of the most important needs of doctors at the moment is to be prepared emotionally to face what they faced. And another one was the communication skills in order to interact with patients in remote.
Yeah, wow. Yes, especially as we start to think about the need now for more and more remote work. And again, how, then the capability to communicate and to have some kind of empathy becomes extremely important. So second level was, of course, which relates a lot to the motivational aspect, which was about values and beliefs.
Yeah, and the question in this case was, what were the most important values and beliefs that supported and reinforced the successful performance you have identified?
So these were things like what priorities, mandates, motivations, were the drivers behind those capabilities and actions.
And in this case, the first answer was with a 65% skills and updates are essential.
Which would, again, if you just take a look at our current situation,
yeah,
updates. And then the second one was, I think this was very important, that patients come first, that everything is organized around the patient. Not around the doctor, not around the institute, but around the patient.
Yeah, and not around economic issue. And the third one is we are responsible for our success. The 50% choose this belief.
And then was, it's important for us to innovate, which I thought was very interesting. That notion that innovation is absolutely an ongoing necessity.
Yes, and the other one is we are capable to adapt. That is for the 34%. And
that would probably be higher today if you think.
Yeah. Now it's a need, the flexibility to adapt to changing scenario every day.
Now, we also kind of put these, you'll see we associated some of these beliefs with also particular capabilities because they seem to align around there. So emotional intelligence sort of aligns with an emphasis on the patient, whereas self-awareness is about knowing, okay, I need to update, I need to stay current, and problem solving is about adapting and so forth. So yes. Our next level of mindset was on identity.
Yes, and the question was, how would you characterize the most important aspect of identity, mission, or role that contributed to creating the successful performance you have identified? So how people and how the organization perceived themselves.
Yeah, and here you can see we were saying that, the successful teams and organizations, they often have a kind of a sense of identity as, a team spirit. And so as we see here, the top one was that people that believe were catalyzers, 49%. And I thought that was interesting, that this identification as a catalyzer.
The second one was about connectors with the 47%. And we see in this period, we saw in this period how important has been to be connectors between people, between organization, between every kind of competence in order to face the particular situation.
Yeah, and then, you know, the third was that 39% was co-creators. So this is really interesting, that this idea that we are creators. And I think from the generative perspective, we see how important, you know, generativity is and generative collaboration is for effective healthcare.
Yes, and the other one is to be builders. With 36% connected with skills and updates are essential and self-awareness. And the last one is to be enablers with a 31% connected with the emotional intelligence and with the belief that patient come first.
So again, we're in this, to build our model, we were sort of, grouping some of these different areas that seem to be aligned with each other. And then we finally went to our last part of mindset, which is about vision and purpose, which has to do with, you know, what is the longer term benefit that they're trying to bring to that whole system. This is really kind of related to the vision of the whole ecosystem.
Yes, and in this case, the question was what were the most relevant aspects of vision and purpose about the case history of success, about the example of success.
And here we had, again, some very interesting results. So the first and highest one was 52% was effectively overcoming challenges and difficulties was the vision.
Yeah, probably now could be higher. And the second one with a 51% was enhancing patients' ability to face illness with courage and hope. And we understood in this period how to have those kind of way of thinking about courage and hope in order to face difficulties, in order to face illness, pain, and something like this.
And the third one there at 44% was raising awareness. Again, we see how important awareness has been in these past months, and the problems that lack of awareness can create, and then the power of the solutions that raised awareness can make. So these, even though this was really before the outbreak of the pandemic back in January, when we were putting this together, this seems to be very relevant and very prophetic in a way.
Yeah.
So here we said then the key areas of if we took those clusters, we would say, well, what are the key success factor areas of mindset? And obviously, you know, a big one is connection, being connectors.
Yes, and the second one is compassion, linked to be enablers, and patients can force like a belief, and linked to it, the emotional intelligence.
And then contribution, so being co-creators, using their, innovating in order to enhance patients' capability to face illness with courage, using interpersonal skills.
And the other one is about catalysis, to be catalyzers and to effectively overcoming challenges and difficulties, and with the belief that we are capable to adapt in order to have problem-solving skills and having problem-solving skills.
And then that's finally this area of competence, being builders, raising awareness, this idea that, skills and updates are essential. So it's kind of like this notion of continual improvement, of self-mastery, and building competence. So how do we put this all together? We take our competence wheel, or rather our mindset wheel, and we put it together with the actions and the outcomes. And this was the model that emerged from this, starting with the outcomes of expertise, empowerment, effectiveness, efficiency, and engagement.
And actions with communicate, care, co-create, collaborate, and clarify.
And then our mindset, connection, compassion, contribution, catalysis, and competence. And here I think it shows this, that we did connect in the model. Certain actions tend to be more connected with certain outcomes. So you can see the point of the star here of clarify, that's related a lot to expertise. Communication is related a lot to empowerment.
Care is related to effectiveness, and co-create is related to efficiency. And together they are linked to contribution.
Yeah. And then this whole notion of collaborating and engagement. So we put here, then in between here, this idea, for example, competence and self-awareness is part of what helps people have expertise and be engaged. So, they supports competence, supports the collaboration and the clarification.
And connection supports clarification and communication.
And empowerment, expertise.
And compassion supports communication and care, and again, empowerment and effectiveness.
Mm-hmm. And of course, contribution has to do with being both effective and efficient, and it's about, caring and co-creating together. So this model is what we found to be something very relevant, and I think it really does show. I think when we look at this, and especially when you think about the health crisis that our world is in today, we can see just how important these things are. Give you a little bit of an idea of what we have already done in terms of applying our model.
Yes, we had an event in Rome, as I told you, last January, with 70 people in the center of Rome, in a wonderful place. And we started with a process with people applying the success factors model, the success factors for healthcare model, helping them to be more aware about their present state and about their desired state, and to build their action plan, all in the all three macro areas: mindset, actions, and outcomes.
So we want to just share with you a little bit what that process looked like, and this, I think, is an important part of how do we apply such a model. So if we take a look at what we did here, coming back to this idea of creating an action plan. So for each of these areas, as Emanuela was saying, we started by creating a scorecard, we called it. So here you can see we had people assess their present state on a scale of 1 to 10 for each of these. In this case, it's the outcome areas of engagement, empowerment, effectiveness, expertise, and efficiency. So they would reflect, okay, where in my place in the ecosystem, what do I think is the level of these outcomes that we're achieving now?
And after this, they define their desired state in the same areas: engagement, empowerment, effectiveness, expertise, and efficiency, by answering to some specific questions that help them to define their goal.
So, and we specifically said in a year from now, which, by the way, of course, none of us were anticipating what's happening now as part of this. So it'll be very interesting. We're actually having our follow-up meeting with that group just before our virtual conference. So we'll be able to let you know during the Q&A part of that conference what's come out. But so in a year from now, how much did they want to have that improved, and how would they know they've achieved it? What kind of impact would it have? What kind of feedback would they be getting? What kind of consequences would it produce?
Yes, and also what kind of thoughts, what kind of, some also questions about this.
And then we had them make their action plan, which was, okay, so what will you do? What can you do to, improve engagement or empowerment or expertise, etc. So again, this was how we did that, and we're having follow-up sessions with them, as we said. And we did the same thing for actions. There's the actions scorecard, again, a scale of 0 to 10. Then defining the desired state. So in a year, how do you want that improved? And what will be your action plan? What can you do? So everybody did the same thing. Then with mindset, what's going to shift in mindset, and what's the action plan? These were some of the partners, by the way, that worked with us in our project.
That worked with us until now. We are looking for other support.
Yes, right. We're very happy to have other partners as well.
Yeah, and now we are there are some links to some articles that.
And there's many more articles now as well.
Yeah, there are more articles now, and now we are going to start the second year of the study in Italy, and the study is going to start in some other countries in Europe, the local study in France and in Greece until now.
Mm-hmm. And we will be announcing the launch of that on May 27th. So just the week following the virtual conference here, we will have our webinar. So we'll be making sure that we let you know about that. And here's where you can go if you want to participate. You can go to info@sfmforhealthcare.com. So now, and the other thing that we're doing is we're at the stage in the next part of this research where if you take that model that we were showing, now the question is, how do we support the development of that mindset, those actions, and those outcomes in various parts of the healthcare system? And we're going to be starting to do a whole mindset training for medical professionals.
Yes, we are going to do. We are going to do this, and the idea is to introduce some tools of success factor modeling for healthcare, just to let people be more aware that could be a different way to approach, a different way to think, and different way to do. So that's the goal.
And this is also one of the things that we feel that this is leading to. When we did our event in Rome, one of the things we had some very high-level, well-known people, and they were saying that that there was really three things that needed to be done for healthcare. One was, of course, the whole technical aspect of medicine and machines. But the other was nutrition, that there needed to be nutrition. But the third was a kind of what you might call a health coach. That is somebody who also is working directly with the patient for, helping them to, adapt and to get through these difficult situations. So health coaching, I think, is another really important development, since we're here at IAGC and many of us are professional, either therapists, coaches, and so I think this opens a really big door for what we can do with generative change.
Absolutely, and in the research that another group made in March, that one that I already quoted, there was an underlining about 3 dimensions of the role of health professionals, like the functional one about clinical skills, technical skills, and something like this, and social one and emotional one. So they live 3 dimensions, and we could, like coach, we could help them to integrate all of these dimensions.
So we know that there's going to be the generative conversations as part of this, this virtual conference, and we're going to definitely have a generative conversation around this area of generative change in healthcare. So we hope you come and join us for that, because I think this is a super exciting, and as we can see in the world today, it's probably maybe the most important application of generative change that is, being called for right now. So thank you for listening.
Thank you.
We'll see you in the generative conversations. Bye.
Bye.
Bye-bye.